Before we proceed, I'd like to congratulate you both for the launch of the book, The Imperfect Storm or An Imperfect Storm. Um, it was truly insightful reading through it and deeply resonated with me. And I hope most of public health professionals from the African continent will be able to place this in context. I was privileged to uh, join you during the lunch in at the pandemic center in DC. What I like about the book, it's in certain areas how you candidly reflected on the issues of leadership and how complex it is to be in the front lines of public health, and the challenges that we face as public health leaders in an area where there is inadequate infrastructure, and how we'll be able to successfully navigate that. So I know, like in chapter 7, that this story you tell about uh, your first response to an emergency, which was the meningitis emergency, and the fact that what should be a problem elsewhere wasn't looked at by the general public to be a problem. How do you believe that you know um, African leaders can prioritize health or public health in the national agendas? Dr. Chike, I'll begin that with you.
Yeah, no, thank you very much. Maybe just to set the scene for your listeners, this was a large meningitis, meningococcal disease outbreak in northwestern Nigeria. Literally, people were dying. It's a terrible disease. If you've managed a patient with uh, meningitis, you will never forget because it's a painful transition, really. And when I went there and with our team at NCDC, we're a young team, and we went and we saw the circumstances in which patients were being managed. And this wasn't hidden. The challenge, what I found most confounding, that is that pictures of patients being managed in very difficult circumstances made their way into the newspapers. I made several press appearances. I thought, in a way, that this would arouse the interest of people and the politicians, but there was almost no interest. So I knew we had our work cut out for us in terms of, this was a disease for which there was response opportunities. We knew what we had to do, but we had to mobilize both the resources, the people, the energy around the response. And for some reason, this wasn't happening automatically. So I knew that, firstly, this whole idea that we are destined to a certain fate because of the circumstances of where we live
Mhm.
and our socioeconomic realities and all of that wasn't something I was willing to accept. So I pushed hard with the team I was working with to really highlight that this is not normal, and we had to reset the bar and not accept that to be the norm. So we published the findings from our response to that outbreak quite publicly, and we calculated the number of lives we could have saved if we had had the appropriate response within the time frame that we needed. And I think that really galvanized a lot of the work we did subsequently. That when you see people dying from completely preventable circumstances, that we as a society mustn't accept that as the norm, as just something that fate has brought onto us,
Mhm.
especially in the 21st century that we happen to live in at the moment.
Yeah, it's such an interesting dynamic because most often than not, whether you are in the clinical setting or in a public health setting, those kind of pictures are very common in our workspaces, and it's almost like it's become normal. We've accepted it to be normal, but as you said, I think we should strive to improve on some of these things. Ms. Vivian, I know co-authoring an imperfect storm must have been an intense and reflective process. Can you share how your health communication experience influenced how you approached writing this book? And what were some of the key messages that you really wanted to ensure came through?
Okay. In terms of how my sort of like health communications experience came through in this book, for us, when we were, even documenting the response was not something that we knew how we would go about to do it. Um, I think back to how everybody at the onset of the COVID-19 pandemic was saying how Nigeria has previously overcome Ebola, that with COVID-19, we're going to do it all over again. And you just kept on hearing the stories of how that happened. But what was really clear was, thinking back to the Ebola outbreak, yes, Nigeria actually did not have as many deaths as other West African countries, which was, by let's face it, luck in the sense that when the first patient came into Nigeria, he went to a private hospital and was immediately seen to by a Dr. Stella Meyer at Adedefo, who unfortunately lost her life in the process, and we're currently we just finished celebrating 10 years since she passed away. But there were a lot of stories then about how Nigeria overcame and how COVID-19, will do it again. But there were never any stories that were documented about the experience of that response. So when the COVID-19 pandemic was unfolding, there was so much happening simultaneously, and the uniqueness of the fact that globally many countries were responding simultaneously. And listening to stories that Chikwe would share when he came home really framed in my mind a need to document this experience somehow. And there was no formal process in which it was done in terms of how we would eventually, release or produce what output it would be. So it literally just started us writing short lines from when he came back every evening. He'd share his experience, and I just started jotting it down. And as I said previously, it was quite cathartic to just have the opportunity to write down some of the things he was saying. And very slowly, before you knew it, it wasn't every day I wrote things down, but on a lot of days there were things that were written down, and he would share. And very quickly it's took shape. And looking back and writing the book, there are things we kind of referred back to almost trigger our memory on a lot of things that were happening, that it's so easy to forget, because so many things were happening all at the same time. So that really was, I think, for us, the starting point of even thinking through about this book.
Mhm. Yes, that's I think that set the stage for a lot of the chapters and experiences that you showcased in the book. And I know for some people that kind of experience seems like far-fetched. So if you're a leader in or if you are responding to a health threat in maybe Nigeria or in Ghana, the expectations is quite different from elsewhere. I know in the early stages of the COVID-19 pandemic, I was leading the Baltimore City Health Department's response as a manager, and we had systems in place. We have, rooms, hotels for people who would go for isolation. We had, communication systems really set up. But that wasn't the case in Ghana. And in your book, you also made mention of inadequate infrastructure. Um, Dr. Chiwe, can you discuss or paint a picture of how complex it is to lead, public health efforts in such environments?
Yeah, Banda, you're right. We don't have a lot of resource for sure on the continent. But what we don't have in resource, we make up with the energy that we have in our people, right? And it's just a resource that we often don't use enough. So what I found is that if you provide leadership and you provide direction to people, and you show yourself that you're willing to go the extra mile, that people do come with you, and they
Mhm.
want to also shine, they want to deliver, they want to perform, even with the limited resource around us. So we live in a resource constrained context. That's our reality. But I do think we make up for a lot of that with the energy of our people, the competence. And when there's a crisis, you see people mobilizing around that to lead our people out of it. So I think, if I reflect today on to me the biggest lesson I learned is when you see people, whether they're Nigerians or Ghanaians or Kenyans across the continent, uh, don't assume what you see when you
Mhm.
see them maybe not acting at their best. Uh, Maybe what they're waiting for is an opportunity to unlock what they have in them. And once there's a way to unlock that and to provide them that avenue to shine, my experience has been, the people I met have been as good as you meet anywhere else in the world. But they don't always have the opportunity to give their best. And so I hope that what the response, and that's ultimately what the most of the book is about, is
Mhm.
demonstrating what is possible when you unlock the potential that many people have in them, even when they work in a sometimes difficult context.
Yeah, that's definitely true. Miss Vivian, I think another important theme is in the area of how we navigate cultural beliefs in in public health response or in public health discourse. In Ghana, one of the surveys that we did uh, really showed that people were not going for the vaccine because they thought that getting the vaccine would change their mind to vote for the incumbent party. So these are some of the issues we are dealing with. And reading your book, I've also come across a part where one government official attributes an outbreak to um, the wrath of God. So, being in this space, how do you really navigate the intersection of public health and deeply rooted cultural beliefs, especially in the context of public health emergencies?
Hmm. I think, one thing, you mentioned the surveys that were done in Ghana. I mean, one thing that we did in terms of influencing or shaping the public health messaging during the COVID-19 pandemic, my organization, Nigeria Health Watch, joined the crisis communications team at NCDC. We were part of a larger team. There were many other organizations that were supporting the response, Corona MS, the Tony Blair Institute, including the core NCDC team, who literally were, very much leading the response. One thing we did in shaping the public health messaging was using data. Um, so there were many data points that we used to shape the weekly messaging priorities, as we called them. So, for example, NCDC had a call center which people called in to ask questions about COVID-19. So the questions people were asking, those were captured. NCDC had a rumor management tool which did a lot of listening to what people were saying about, different health issues. COVID-19 was just one of them at that particular time. It's called Tatafo. In addition, NCDC had a very, very vibrant social media platforms. By the COVID-19 response, there were over 1 million followers on Twitter. So all these data triangulation points, including looking at the weekly, upsurge of COVID-19 cases, now inform the public health messaging that we now kind of put out. So, for example, on a particular week, if we noticed a lot of people were suddenly asking, about COVID-19 vaccines, that it gives that if you take the COVID-19, there was that 5G rumor. We now had to use the different messaging platforms and tools to disseminate messaging. So, for instance, on WhatsApp, we would use infographics, videos, cartoons, radio. We would now have different spokespeople go and speak on radio in different languages. So those multiple platforms targeted at different audiences really helped shape and ensure that when we are putting out public health messaging, it's aligned with what people are saying. And we're actually using different data points to listen and understand what is being said. And that really, I think, was very helpful in ensuring that the messaging, which was framed around a campaign called Take Responsibility, was better informed to be able to address some of that misinformation and miscommunication around the COVID-19 pandemic.
Yeah. Yeah, and I think it's certainly vital. You've highlighted a very essential component of health communication, that is real-time response, using uh, evidence or data to kind of shape your messaging in dealing with misinformation.